Nkohkwo, you wanted to ask a quick question.
It regards African obesity. I think one of the things that AI actually is a cultural. We have a cultural aspect. I would take Mauritania because Mauritania is the one with the highest, where men prefer obese women. Even in the Bamileke culture, you're laughing. Bamileke culture, the Ngrafi, they also prefer obese women. And that brings to the why. I remember when I was younger, when they were taking a young woman to go to work, they kept her in a hut in Bafoussam, and they fed her for a few months for her to put on weight, for her to go to her husband's house. So there is a big cultural issue. I'm not disputing all the medical concern. I'm just saying before we could address that, there's a cultural aspect for us to think about.
Can you just bear with me, please? Excellent question. But it is very important that now that we're entering the actual Q&A, those are the kind of key sort of thing that we want to address. So please, Collins, could you just stay with us here, please, because you're also part of the panel, part of a member of the panel. All the panelists, the people, all the speakers, please, if you don't mind coming forward. Dr. Phyllis Navti, Dr. Louis, it seems Dr. Buea has gone, has left, but we've got the other panelists here, and we've got our key. Remember I said earlier that it's important that such a wonderful event, it has to be captured, not only captured in Kodak, but also captured for something that we can actually disseminate across afterwards to those who could not attend, and even for those who want to have something to remember. So we've got the panelists here. What's happened today is, so we have here amongst the panel, we've got a key rapporteur, one of the rapporteurs, who is Dr. Gisela Dedino, who is going to read out. The rapporteurs have pulled together their notes, and we're going to have read out for us what are the key messages that have come across from this day, and then we will take that will lead us now into the debate. So, Nkohkwo, Dr. Nkohkwo, we haven't forgotten your very exciting question. So we just want to make sure we explain the structure, how we're going to do this finale. So we're going to start. We had Dr. Louis Anegekuh, who spoke on the basics, the foundations of AI. And I remind folks that he has an AI course online, which is still available for CamDoc members. To those, I did the course myself, and that's why I really got my grounding on AI. I'm not an expert yet, but okay. And then after that basic, we then had a deep dive where we had Dr. Stefan Bola, who is a member of the Cameroon Academy for Digital and Information Laboratory based in the UK and Cameroon. And he's also director of a number of schools here in the UK on the implementation of AI. He actually focused on the 3 Ps, being predictability, prevention, and what was the 3rd P? There you go, so we're already awake. Yeah. Now, so he addressed those, and then we had now Dr. Osric Navti. Professor Navti, actually based in Qatar. He took on the topic of how to embed AI into frontline clinical decision making. We then had Phyllis, the other half, the better half, who addressed getting AI ready health workforce. We then went on to Dr. Sintieh, who spoke about AI in resource-limited environments. But there were key messages. That finished with Collins, who just brought the reality of it by looking at a literature review, a systematic review of literature, using AI as a key tool, as a lot of the experts have been saying earlier. But let the rapporteur, the chief rapporteur, Dr. Gisela, to tell us the key messages, after which we then get on to the proper debate.
Thank you very much, Chief. And that sounds like a very sophisticated title. To avoid wasting time, this is just a very succinct compendium of what we've discussed. And I must say, well done to our speakers. Thank you very much. We have had a clear and timely message, which really says artificial intelligence has the potential to transform healthcare, and its greatest value will come when it enhances, not replaces. So I guess the key message that it has to enhance and not replace. And what are those items? It has to enhance the expertise, the judgment, and the compassion of the healthcare professionals. So these presentations have highlighted several important themes, right? So the need for AI literacy across the globe, the opportunities that it presents for education, clinical care, and research, and the importance of strong governance, ethical safeguards, digital infrastructure, and ongoing training to support an effective adoption. So as we move into this panel discussion, I would like to invite our panelists here to reflect on how we can translate these ideas into practice. So how do we ensure AI is used responsibly, equitably, and in ways that improve patient care, strengthen education, and support healthcare professionals rather than add burden? So perhaps we can begin by asking, what are the most important steps that healthcare organizations, educators, and clinicians should take now to ensure that AI is implemented in a safe, effective, and with focus on patient interests? Who would like to start?
Thank you. And the natural step is always with awareness. The first thing to do is the knowledge. If the medical practitioners could start by gaining the knowledge that they require to understand, like we have discussed across the presentations, the importance of understanding what is AI, the risks that come with using AI, then they can easily integrate that into their daily workflow.
Yeah, I mean, I think there's two components to this. There's the level of individual responsibility and a sort of a keenness to learn about what is clearly something that is very useful and only going to improve the quality of care that we provide. So as individuals, we all need to step up and learn about AI. The real danger, and I think it's something that we highlighted, is about what's gone into these tools to guide the information that we're getting on the other side. And we, from the populations that we come from, need to be very mindful of that because our populations are underrepresented in terms of what's been fed into these models. So the advice doesn't always necessarily suit our population. So that's where the oversight comes in. So the information may be generic that you get out. So we need to be sort of driving research in our communities, in our setups, to be able to get information that provides the guidance that is appropriate for our communities. No one's going to do it except we push it as a community, and that's really important. So recognizing that individuals, we need to learn about this, but also learn about the risks involved. The other issue we sort of touched on before I move on is the fact that we need to be careful in terms of equity in this field. There's 2 countries leading it and a handful of companies. How do those people control the information that we're getting? And if they start charging for something we're becoming really dependent on, how does that play out? Okay, and there's a real danger here. At the moment, you can say it's available, but people can put firewalls in front of this. Okay, it's not impossible, and it starts very basic. You just put a firewall and a cost implication, and then that sort of really impacts severely the people that can least afford it. That should be the ones that need to benefit the most from this.
I think the only thing I want to add is about, because literacy is important, learning and using it and being aware of the risk. But the one thing is policy and frameworks. So institutions need to have the policies and frameworks that support and enable the safe use of AI. And within those policies and frameworks, then they specify AI literacy, like what is the minimum expectation around AI literacy for everyone. Because, you know, what Dr. Bola said that stuck with me is about being a liability if you don't understand AI in this day and age. So if organizations have that within their policy and framework, that even if you don't use it, be aware of it, that would keep it safe. So that's the one thing I wanted to add.
We have online Dr. Ekongefeyin wants to add something.
Yeah.
Yes, please go for it, Sintieh.
All right. Thank you very much. So I like all what we've shared, and I want to follow on to add on. The first thing is capacity. All of us clinicians need to get our hands dirty. Sorry for the word. With AI, like really understand what it does and how it works and how it's useful. And then now, data equity is a big thing. We are not represented in the data, but it takes people who know what they are doing to actually effectively use the tools that are probably half-baked. So that is why clinicians are probably the best case here. And so if you understand what this thing has underneath the hood and you can then use it, leveraging on its strengths and then being aware of its weaknesses, then you can move on. So I think what CamDoc is already doing, like bringing panels like this to discuss it, is already a step forward. But for each of us, like it's already said, we need to take that personal step to also get educated, get the skills, get the knowledge exactly on how to use it. Now, I want to talk about cost. It's already very expensive to train models. I mean, if you look at the cost of running Claude Anthropic's things on the API, if you're doing that on a 24-hour basis, you run on cost of about $100,000 to train a model. So that is very challenging. And if we have to do that for Africa, the question is who has the capacities to pay for that? And so, yes, there's going to be, all of these companies are going to go IPO by 2027. And so everything is going to be costed, and you don't want to be paying for tokens. And I think for us who are owners of health facilities, systems, trainers, and all of us, you need to be thinking on how do we make it sustainable and bring in the technology. And so health systems, like technology in healthcare, have evolved a lot. Initially, we were talking about digital health. Now we're talking about AI, and the health system was not even ready for digital health, and now we have AI. So it's adding several layers, and the goal is how do we make it sustainable? And for me, that's why working with the open weight, open source models already, it's a good thing, because regardless of the model strength, regardless of the model cost, you can build a system that can stay for long in your health facility or in your country or whatever, and then just fine tune it, get more data that gives it its local perspective and color it. And so we have a foundation, but whatever you decide to build on that foundation is left to you. If the house is going to look yellow, fine and good. If it's going to look green, fine and good. But that's what we can do at this stage, and building on what the big tech companies have invested millions of dollars on. Thank you. Over.
Thank you very much.
The one other thing which we also need to acknowledge is the fact that all of us sitting here, we didn't start our primary school education thinking that we're going to be medical doctors. We had to study, learn how to write, to read, and so on. So where we are now with AI, it's like a baby step. Some of us will be frightened about it. It's always going to be here. That is why when we had the initial conversation with CamDocUK at Doc AI Academy, we offered a foundation course to all the members that, okay, listen, we are offering this for free. Learn it, just understand what it is. And that gives us the opportunity to introduce something that people could actually use and learn it as a baby step, like I said earlier.
Thanks so much, dear panelists, for those succinct recaps of what we have gone through today. Looks like we have about 3 minutes before the planned end of the conference, but I'm going to hand it back to Chief. Do your magic and see how you can fit in the rest of the Q&A inside of that time.
Thank you, Dr. Dizino. Now, if your adopted title is moved from Chief Rapporteur to Co-Moderator. Anyway, I think we remember earlier, before we went into this session, a very interesting question that was asked by Dr. Mpharm, based on the systematic review by use of AI by Dr. Collins Asongazi. This is a proper moment for us, and it was a very exciting question, and I had to keep everybody on hold. So, Collins, would you want to actually pick on that?
Thank you very much, Doctor, for bringing out that. In the review that we carried out, we saw that the main factor driving overweight and obesity in Africa is urbanization. That doesn't cancel the fact that there are other factors, but the main factor, and when we talk of urbanization, we mean people in Africa trying to copy the Western style of life. For example, in Africa now, they're trying to have Ubers, they're trying to have KFC. So they're trying to have, like, if in Africa, it is the person who eats butter every morning that is considered to be the rich person. So they are trying to copy Western style of life and becoming more sedentary, which was not so in the past. Meanwhile, in Europe, people are trying to get more active, trying to go to the gym. So that is the main factor that is responsible for the rising cases. And also with poverty, because most of these unhealthy foods are very cheap. So people tend to buy them. So I'm trying to say that, yes, what you said still stands, but the main factor is urbanization that is driving most of the cases that we have.
You got Dr. Nkohkwo, could you use the microphone, please? Thank you.
When you're talking about food, I think if I recall correctly, people could correct me if I'm wrong. In Cameroon, actually, it's our local food that is cheap. What is actually expensive is the McDonald's, is all of this other stuff. So I don't. The reason I brought that particular theme of our behavior, which is something that we are brought in with, is because it's quite an important thing. It's true what you said about urbanization, about lack of mobility, people driving more cars so that they don't move along, they don't go to farm anymore that they used to do. But the food that they're eating, the poor people, if you look at it, is not kebab or KFC. If I go to the Bamileke land, they'll be eating a lot of corn and a lot of cocoyam and so on.
Thank you, Dr. Nkohkwo. I think the key line of your challenge is very clear. But let's refocus that this is, we want to look at, I think you're also illustrating what a number of the speakers said earlier, that we should have a mastery of the AI itself. So this is a systematic review that has been done using AI, and clearly the report is being challenged from very strong perspective that you're bringing out there. So let's refocus on the AI. I'm going to come to you. There's quite a few, we have ample time. This is the time for us to really drill down what we've been discussing today. So please, don't hold your fire. I just want to remind us that Dr. Sintieh is also there, and as he spoke earlier, he's back online, joining us from Zurich. He is particularly interested in application of AI in low resource setting. I think let me take advantage of this, the fact that I have the microphone as the moderator and start with myself. Dr. Sintieh, I don't remember you saying something about the challenge of connectivity. So many times we had events, we have moderator, we have people, panelists from Africa, and then suddenly we have difficulty with connectivity. How do you see this problem of connectivity in low resource setting in order to use AI? I know some of you are here about connectivity, how about energy, but let's address connectivity for now. Dr. Sintieh.
All right. Thank you very much, Chief. Can you hear me?
Yes, we can hear you.
All right. About connectivity, I think I'll draw from, I think it was Dr. Bola's slide, which spoke about the penetration of internet, and I think up to 95%. I mean, it's a known statistic. But the first thing in the age of AI, and it's one thing to bypass it because we understand the challenge. The internet bandwidth is not stable. So we need to use what we call lightweight models or small language models. And these models can operate with a very low bandwidth. For instance, what I showcased during the presentation was a light version of ChatGPT, which is running locally on my laptop. It doesn't need the internet to work. And so the goal here for us in resource limited settings, I really don't like using that word, but I'm forced to use it. But in settings where we don't have stable internet and things like that, and you need to use AI, then you need to ground yourself on a very local model that can run regardless, even there's no electricity, as Sokadel is very prominent these days, and there's minimal internet. And you can have that with you offline and work. For me, that is probably the best way that we can make progress as people who come from a resource limited setting to use this technology, because they are already there. Teams are building several of them like at the speed of light. Now, with respect to now having it in real time online, once you already have a local model, if you travel to the city center, then you can upload the things you need to do with the internet and then come back. Same thing if it's a local cloud. Once you have the internet, you go back. And so for me, it's having that system where you have that over the control over what goes online and when it goes online, and that stays and it maintains what the patient privacy, the quality of the data, the context specificity. And so if we are bothered, like the question about obesity, we can always add a feature to the model or a weight to the model to find out what culture influences on obesity for people in a particular setting. And that is mathematical. But again, this is insight that if you're not a Cameroonian, if you're not Bamileke, you would not know that people actually want to look fat before they get married. And so, but this is what we would use to learn to train the model or fine-tune the model. And again, the model is local. You have it on your mobile device. I mean, so that's it. That's my approach. And I think we have huge opportunities because we won't need the big data centers to train the models first, which we cannot afford most of the time. And secondly, we would have already things to build on. And now we have the knowledge and we can adapt that. Thank you, and over, Chief. I hope I attempted your question well.
Okay, thank you, Dr. Sintieh. Just to buttress a point that he's made, we've just finished a project which we intend to release a new AI model that is not based on internet connection in the next 3 months for road safety. So drivers are able to drive and we are able to capture their attention span while driving a car. So we don't need internet connection for that, which we have installed on phones and also on standalone IoT devices. So it's doable.
So I think, yeah, Dr. Nafti would like to add a comment or two on this.
Yeah, I think the one thing I want to just say again, re-emphasize the importance of policy for connectivity. So say the University of Buea, University of Yaoundé, they made it the policy that it's important. They will put the budget towards it to build all of this. And then the teachers have access, the students have access, and it becomes something which is, it's not doing as an individual and trying to pay for it, but it's something that the country recognizes as important. And the budget goes towards that. So yeah, that's what I wanted to say.
We see here that it's not just the issue of using the internet per se, but as alerted us to, we have to use the internet, but make sure that we're from a point where we're actually able to recognize the challenges that it poses to us. We don't just follow it blindly. But we had a number of questions in the hall, and I want to start with, we're going to come to you, Mami Muffuh, but let's take Dr. Elvis Ngasa first, and then the next, after Dr. Elvis, will come to Dr. Ayuk Muffuh from Ekong.
My question is for Dr. Sintieh. My name is Elvis Ngasa. I'm a transplant surgeon. In your presentation, you mentioned a first case, the case of that 35-year-old lady with hypertension who unfortunately passed away. From a practical perspective, in your opinion, how do you think AI could have helped to prevent her death? Thank you.
Thank you very much, Dr. Ngasa. So there are many ways, right? First, when in the slide where I spoke about the constraints that we have as clinicians in the front end is we have paper-based records. So the first, if we had Christie's data and like data set everything, like what she's been doing over the last 5 years or so in an EMR system, electronic medical record system, together, if we had her current blood workup and all of that in one space. Now, these are all features, inputs that we give to a model to learn. And so just looking at, for instance, the Q-RIG score that we use to determine risks for cardiovascular risks, this is a similar thing that these models have, but now we can put all of that and it gives us her predictive risk factor, and the model could look at it and triangulate it with data from, let's say, the region in Cameroon where she comes from, and maybe say, oh, maybe there's an outlier or so. Now, it is not a guarantee that it will be accurate, but it would have given us a better insight on her risk case, because we will be able to put in various models of the data. In one of the presentation, I've forgotten exactly, it was about, I think it's Phyllis's presentation, which will talk about multimodality, that was in education, but the models learn best when they have inputs from multiple models. And so if we have the history from the family from that, and we put all of that, and it's feed into a model that has been fine-tuned for Cameroon, I like to use the word fine-tuned for that setting, because the open source models could do the same very well, but they'll not be that specific. But if we could put all of that, and I myself back then I had that, and I could run that predictive score and not just look at my Curie score on my Medscape at the time, or Framingham had on my Medscape at the time, and say, okay, this is it. I would have more confidence. Maybe it would have been different. So that's the hunch I have. But going back in time, if we had that data, if we had the system, then we can actually trace it. And that's how most of the predictive studies are being done now, because they have electronic medical patient records for a group of people for 100 years or 30 years. And then they actually train the AI on all of that, and it can make those connections. I think that's how I think it would have helped us. And hopefully, if we get to that phase where we have a system and we have policies that enable us to build these data centers from facility to facility, we can then provide the good data, not the garbage that our models will learn on. And we all know garbage in, garbage out. So we don't want that to happen in our setting. And we have the opportunity to learn from the mistakes that even the NHS Digital has done, because they've invested billions of pounds in building these systems that are not even used between trust. And really giving that would be important. And so going back to Christy's case, if we had all those inputs in a model, maybe we'll have a lot of triangulations, just as the models give you many answers to one thing, then you'll be able to predict that. I hope I attempted your question. Thank you.
I think actually that might. Yeah, I was just looking up something, because I remember like over a year ago, this is already happening. For example, in Rwanda, they have this concept, one patient, one record. And it's a national program, which means across any health service, private, government, same records across the country. So you can see how, if you integrate that sort of health record for someone like Sintieh, that would make such a massive difference. Because who was her name? Christy. So you would see how that would make a difference, because it doesn't matter whether she had a visit at her private doctor or in the health center or in the secondary hospital, the vitals will be there, her blood work will be there, and that can then, AI can look at it and interpret it and come up with a risk score and assessment for her. So yeah, so that's kind of forward thinking that we need in our country. We pray for this. We pray for this one day.
Hello, everyone. My name is Muffuh. I'm in the pharmaceutical world. I'm a pharmaceutical physician. I have two questions. I just wanted to find out, we've been talking here about physicians learning about AI and trying to use it. Do we really have a policy in place in Cameroon by the Ministry of Health that is guiding this process? Because if a physician uses AI and misdiagnoses a patient, who's liable then? Is that physician held accountable for the misdiagnosis that has been done by AI, or is it AI that will go to court for that? And the second thing is, we've been talking here about every physician training themselves, getting AI ready and all that. What is the Cameroonian government? Because I know a few people here work for the Cameroonian government. Is there anything in place for AI? Because it's coming. And in order for anything to come, there should be regulations, because I work in regulations. Are there policies in place? Because it's going to cause a lot of trouble in the future if we do not have guidelines, no policies, nothing. Because we can't be training people when there's no SOP, no protocol, nothing. to guide them in the right direction. So that is where my concern is. Thank you.
Yeah, I mean, I'll touch on this because I briefly touched on this in my talk. And it's a challenge. It's not just Cameroon, by the way. I think worldwide there is real issues with accountability at the moment in terms of AI use. And the issue is there's no worldwide standing operating protocols with regards to this. So what you're starting to get is you're starting to get colleges and organizations, professional bodies, starting to come up with frameworks in terms of how physicians should operate and use AI. And you saw a little bit of the report from the American Medical Association, which was just recently published, and they have some snippets and guidelines in terms of the sort of the learning side of AI for physicians and for patients, how to appropriately use it. So there's beginning to be some sort of discussion around this. The technology is just advancing and just driving so fast that the policies and everything is catching up way behind. So it's one of those things where I doubt if Cameroon has, I don't know, obviously, but I doubt it, if Cameroon has any sort of policies. But part of the beauty of this is that it could be a great equalizer, because what you then do is you can sort of actually jump forward and catch up in terms of the benefits of AI to improve the quality of patient care. But that really needs to come from sort of proper thinking and policy and stuff, which you will see some countries making great efforts at. So anyone who works for the government, you said...
can I just make a quick comment here?
There's no named person, but who's the one? Because that would be helpful. Anyone works for the government?
Dr. Nafti, I think what we can say is very important question that Dr. Ayuk from Mekong was asking there. What we can say is that the experience of CamDocUK so far is that we hold this public engagement, we hold this sort of discussion, debate forums on either webinar or whichever forum. But what we realize increasingly is that it has an impact in Cameroon in the sense that we have medical schools that are actually accessing these sort of discussions. And we ourselves, on the other hand, CamDocUK database includes Cameroon government avenues. So while we're not here talking for the government, but we can, on behalf of our own stakeholders, channel the concerns that are coming across. So that's why we're saying that this event is being recorded, is going to be produced. We're going to have professional papers out of this and statements. You heard earlier on the key recommendations that was coming from the rapporteurs. These are information position statements that will be sent to appropriate quarters, including government circles. But we don't speak for the government, but we can reassure that it is important that a whole day we met here is not for nothing. At the very least, not only impacting here, but also contributing to impacting where we come from. I think that's where I want to say that, can comment on. But we have, the debate carries on. So let me suggest that we carry on with the other questions as well. I've just been alerted that Dr. Sintieh had a comment on this particular aspect. If we just can be brief so that we can actually move on to other people in the hall. So that the people are really anxious to raise some comments on this debate we're having. Dr. Sintieh.
Thank you very much, Chief. I think every policy and government, like Prof has said, they are catching up. So it's not about only the Cameroon government, but it's also about the entire world. The WHO has recently released a lot of AI guidance from their policy workshops, but everything is a learning by doing. And the reason why, for me personally, it's for us to first of all take the human agency. It's because that is where it all starts. And the doctor would always fall accountable. It's called the moral crumple zone. And that's it for every technology. So if you have to stay accountable while waiting for policy to come into place, then you need to get educated to how well you can use these tools that are already in your hand, because all of us are using it officially or unofficially, and you need to be clear with what your trust and your government is allowing you to use. But again, you have to use it as a human being, and you have to be able to strike those differences. But that's just my point, that the governments are going to catch up, but again, it all starts with us, the users. And everybody is doing that catch-up, but they can learn from our experiences and from our educations. And forums like this also gives foundation on what the current clinicians are thinking about and what could be useful as a policy to every other organization that we are affiliated to. Thank you very much, Chief Oba.
Like you said, I think the key point noted here is the fact there's a recommendation for a policy position to be taken by not just Cameroon government, generally, even our various organizations, like started with CamDoc's very own policy on AI. We have CamDoc dealing with almost 200 physicians working. What's CamDoc position on it? But let's move on to try and get many more people to come on. The gentleman at the front, you had a question on, you had a comment. You had a question on this.
Oh, thank you. I thought I could just talk for England, but thank you for this opportunity. My name is Stephen, like I was saying, crew member of Key Bank and Monifex. I've got a worrying question. Might not just have arisen today, it's been living in me. And this is to any member of the crew can answer this question, but I would have loved Collins. Yeah. Perfect, thank you. To throw more emphasis on this. You spoke about weight and obesity in maybe African countries. And you said this is maybe due to our lifestyle and diet. I just want to find out whether genotype can affect phenotype. Has that got any relation? Could your fat gene, which you've inherited from your fat parents, affect you? Just want to know. Thank you.
Thank you very much. Yes. I said the main factor or driver is urbanization from the literature that we have. But there are many other factors. Kwaya mentioned the cultural aspect. You've mentioned the genetic aspect. Yes, but putting everything together, it is becoming a problem because Africa and other low and middle income countries are trying to take on westernized habits, but it is not, so there's a change in the lifestyle in these areas. So, and that is the consequence of it.
Yeah, it's getting really exciting. I should point out that it's also very important that if you don't mind, we'll try and drive us back to the focus. Clearly, let me just say that you asked a very important question, which is in medicine, we talk about nature and nurture. That's essentially what you think about it. You have genes, but also the environment has an impact on it. That's why you can have two people with the same genes, they're manifesting differently, but the gene is there underlying. Let's leave it at that point. We can have a debate after that. Outside this, we can talk about it. But let's concentrate on AI in healthcare for now. Anyone, any further questions? The lady at the back, she had her hand up earlier, so let's.
Thanks. Good evening, everybody. I am Dr. Clarisse Kingekolo. I'm the president of MedCamp France. And I'm very happy to be here today. Felicitations first for this, all that presentation. Very, very, very high quality. And excuse me to continue in France, but I think that everybody here speaks French. Because
can you bring the microphone closer to you and speak up a bit? Bring le micro, si, ça va.
OK. Donc, je disais que le thème de l'intelligence artificielle est primordial, important, et c'est vraiment félicitations à CamDocUK de l'avoir mis à l'ordre du jour aujourd'hui. La question que je me pose, c'est au niveau de la responsabilité médicale. Nous savons qu'en médecine, le médecin est responsable. Nous faisons partie, nous, tous dans cette salle, nous avons appris la médecine à raisonner à faire confiance en notre raisonnement. Or, la jeune génération qui est en train de faire des études, on leur parle d'intelligence artificielle qui est plus performant pour le dépistage, qui est plus performant pour la prise en charge, qui peut prendre en charge individuellement, etc. Et on sait également qu'il y a un risque zéro, que le risque zéro n'existe pas. Alors, ces étudiants à qui on n'a pas appris à faire confiance en leur raisonnement, mais plutôt à qui on a appris que l'intelligence artificielle est meilleure, comment est-ce qu'ils vont se comporter demain s'il y a un problème, s'ils n'ont pas appris à faire confiance en leur raisonnement? Alors, je ne sais pas, c'est une question que je me pose et que je pose à tous ces experts, ceux qui enseignent, c'est la préoccupation, comment apprendre aux futurs médecins à être responsables si on leur dit que l'intelligence artificielle est meilleure pour la prévention, pour le traitement, etc., à moins qu'on ne mette en place la responsabilité de l'intelligence artificielle demain. Voilà.
Wonderful question. For those who may not have followed what you're saying, the challenge of the issue of this wonderful instrument, artificial intelligence, comes also with responsibility, which is the point that has been belabored by the number of speakers have said, the responsibility. And she focuses a lot more on, we are now having a generation that's being brought up within this framework of, so how are we going to ensure the responsibility of this generation? Know that even though they shouldn't take it for granted. That's essentially the message that I'm getting from the question to us, or to the panel, or to all of us here to debate. What are we? How do we see ourselves in such a situation that we can make sure that there is some sort of level of responsibility placed in the way, especially in the way the younger generation are actually going to be able to use this technology in their training? And if we are back to this issue about responsibility, anyone want to comment on that? Oh, Dr. Sintieh, est-ce que vous avez compris ce que notre docteur nous avait demandé comme question?
Merci beaucoup, Chief. Et merci beaucoup, docteur. Ta question est très claire et c'est très important. Il y a de cela 2 semaines, et j'avais une présentation avec un groupe de chercheurs africains. Et l'objectif, c'était important d'éclairer que avec l'IA, on doit essayer de travailler pour ne pas perdre notre pouvoir d'agir. Donc, l'objectif est nous rentrer sur les hôpitaux et les universités, et toujours, nous tous ici qui sont des professeurs qui sont en train de former des jeunes, de leur assurer que c'est important d'utiliser l'IA, mais il faut toujours avoir ton pouvoir d'agir dans ces jeux. Et maintenant, ça change le balance avec trois schémas à regarder. Donc, déjà, si tu as une idée comme étudiant, tu peux utiliser l'IA comme ton sparring partner, comme ton première intention d'évaluer cette idée. À la fin, tu dois discuter ça avec ton prof, avec tes collègues et réévaluer. Mais déjà, il ne faut pas utiliser seulement l'IA et donner ça à ton prof pour évaluer. Mais donc, on doit mettre ça que nous tous, on doit être l'IA natif, comme on dit maintenant. Mais c'est important que tu restes et tu gardes ton pouvoir d'agir. Maintenant, ce pouvoir d'agir doit commencer avec nous, des enseignants, et nous, des professeurs qui sont déjà en cette capacité de former la prochaine génération de médecins et de personnes qui doivent prendre soin de nous. Parce que quand vous aurez déjà en retraite, ce sont les jeunes-là qui vont te soigner. Donc, tu dois rassurer qu'on maintienne ce pouvoir d'agir. Donc, pour moi, je veux dire que la responsabilité reste celui de le médecin traitant. Et l'IA, c'est seulement un toolbox, quelque chose qu'il peut l'utiliser pour être plus apte. Et maintenant, comment être plus apte avec l'IA dans ta main? Cela doit rentrer dans le nus et le mode d'emploi les enseignants, les universités et tout. Mais voilà ce que je pouvais dire à ta question. Et je pense que c'est quelque chose qu'on doit discuter beaucoup plus dans ces temps, que l'IA évalue beaucoup plus que la sagesse humaine. Merci beaucoup.
Excellent. Docteur, comme vous avez demandé une question rhétorique, quoi. So essentially, it was a rhetorical question which essentially emphasizes what we have been saying today, that the ultimate responsibility rests with the physician. And so it's important that the physician should be aware about the limitations of, in as much as this tool we are talking about is going to be very helpful, helping them for efficiency, productivity, and all that. It is important that that awareness is there. So it's essentially, I think the question comes across clearly, and the answer is suggesting that it's a rhetorical question. That's what it essentially is. Vous voulez ajouter quelque chose encore?
Non, je crois qu'il a tout à fait répondu à la question. Hein, c'est important que les enseignants apprennent quand même à leurs étudiants à garder le sens critique. Et en tout cas, bravo encore.
Excellent. Excellent. We will follow up with another conference in, is it France or in Belgium? We'll follow another conference and in Switzerland. And we have the next.
The other thing, of course, is that remember that as physicians in training, we still have competencies and things that we have to meet. Okay, the question is, are we using AI to assess those competencies? No, not yet. So as a physician, to be qualified as an obstetrician and gynecologist, there is still competencies that you have to meet, largely dependent on interaction with patients and proving that you have those competencies, right? So there is still that sort of human sort of oversight. The issue, of course, is that, you know, as you're seeing patients or interacting in your day-to-day work, you're probably using AI more as a guide to help you when you see patients and when you make decisions. So that really, we need to remember that this is a tool that we're using to improve our competence and sort of effectiveness as doctors, rather than to make decisions and replace us.
Our education lead, we're coming, the microphone, he's got the roving microphone. You wanted to?
Yes, just to add to.
So this is Dr. Gail Nana, who is the education lead for CamDocUK, just for the purpose of, for those who were not here. Gael, oh, there you go. Gael Nana, or Pa Dan as we call it.
Thank you. Just to echo Dr. Nafti's point, I just wanted to relate an anecdotal evidence that happened recently, where I had a patient who came to clinic armed with information that it had, having trawled ChatGPT. And it was still important to, and in fact, it wasn't actually the patient themselves who had the information, it was the patient's relative who was asking the questions. And it was very obvious that they had trawled the internet using generic terms and prompts, and they still, at the end of the day, wanted my opinion to get to a final plan as to how to proceed. And it's relating to the point that our eminent colleague from France, from the MedFrance mentioned. It is the final responsibility about guiding that patient to the appropriate treatment rested on me, and be my ability to convince them that what I was proposing or recommending was better, or at least the most appropriate, well, in my limited opinion or professional opinion, compared to what they had gathered from AI, was the way to go forward. Now, they may disagree with it, and if they have the capacity to do that, that's entirely accurate. My responsibility at that time was, I've given you the information, you either take it, or I'm very happy to refer you to somebody else who would provide the treatment that you want, because ultimately, the patient or the person sat in front of you, if they already have access to the same information that you have, in inverted commas, because some of this information may not be curated, as we've seen, then that ultimate responsibility, I can only be responsible for what I know and what I have counseled them about, and ultimately they have to make the final decision about the care that they would like to undertake.
Wow, excellent interaction happened. I just want to point out that we have other CamDoc members and people globally following this through YouTube, and I just received almost a dozen people sending releases out already from Mimi and her team. Mimi Muffuh information, who are actually right here. People have been sending the press release, they've sent out back to me, which is interesting to show the interaction. A question that came through the YouTube channel. One of the CamDocUK members, Dr. Louis Anegekuh, he wanted to know the importance of the reassurance about data protection and the use of in Cameroon in terms of with this evolution of this AI. I suppose again is back to the same question relating, just to save us time, is today again with the policy issues. The message couldn't be stronger that policy in terms of the governance of the use of this technology. So rather delivering that point, let's continue with the debate as it rumbles on. Dr. Celestine Voma. Okay. After Dr. Voma, we will have Dr. Jean-Claude Kate, and then the microphone will keep going around. Yes.
Hello again. This question is directed at our preeminent Dr. Phyllis Navti from the educational side of things. So, if we recall, some years ago, there was this thing about sex education and how to get kids to appreciate gender dysphoria and gender fluidity and all of that. Now we have artificial intelligence. Let me call it education. So for the sex education to get to the kids and build up a generation of sex fluidity aware people, that was put into the curriculum through even Ministry of Health and government policies and even acts of parliament. So can AI education be grafted into medical school curricula, primary school curricula, and through the whole educational system as part of a really valid way of bringing this new cosmic knowledge into our curriculum, into schools, into teaching, into education? Thank you.
Yeah, that's a great question. And actually, it's not can it should. So basically, UNESCO came up with a set of guidelines for AI literacy back in 2022-23. So same time when ChatGPT went viral or generative AI went viral. And it has core principles, the UNESCO principles that countries, organizations, institutions should have to support AI literacy. So the fact that it's not being done, it means everyone is kind of behind. So the West and some institutions are way ahead. Whereas if we don't have it in Cameroon, then we're not following what UNESCO recommends. So you're right. I don't know at what level you're saying. I just assumed it would be a secondary school level, but even primary school kids are using AI now. So your Gen Alphas. So I think it needs to start from the bases, universities, medical schools, to help train our doctors. Everyone should actually have some sort of AI literacy teaching. The content has to be context specific for the particular area, but UNESCO is clear about that. And other things around AI, like the bias, how it works, the risk of AI. The one thing I didn't say actually is that which hasn't come across is also the sustainability factor, the harm to the environment when we overuse it. So there's all of these aspects that we need to learn about. And I wanted to throw in about some very early adopters and what they're doing, like Stanford University in America. One of the people that made me become very passionate about AI, because I am CPD assistant director, he's the lead of CPD in Stanford. They use a lot of IT. And 3 years ago, when I had my first AI workshop, went to the conference where my university was very big on it, and we went and did the training, and he came and was running workshops on how to use it. He said one thing. He said at work, all his employees, all the people who report to him, if you're not using AI, there's something wrong. So he was actually performance managing staff who were not trained or using AI. And he was the admin staff. You had to explain why you were still writing emails when AI could do that. So he was not getting rid of staff, but he wanted to make them more efficient. And Stanford University, they have a AI literacy program, and all the top universities in the world, the medical schools, they have that already. So it's something that I cannot emphasize or recommend strongly enough.
So two further quick questions, one from Dr. Jean-Claude Kate, followed by Dr. Leonard Ngaka. But before we come to those, One member of the panel would like to add a comment on this particular topic, this question. Dr. Louis Anegekuh.
Thank you, Chief. With regards to education and kids and AI, that is something that we identified at DocAI Academy. For those of you who were here to watch the opening presentation by myself, we have actually created a universe. That universe allows us to create up to, I think, have about 24 episodes of AI being discussed in a family setting with kids understanding what AI is. For those of you who were in here, you heard asking what will happen if I don't learn AI. So those are the kind of things that you can easily integrate within your home, within the community to ensure that kids are also involved in learning AI. It might not necessarily come at the level of the government because waiting for policies to kickstart these things is going to take a long time. It's us, the parents, who take the initial initiative to make sure our kids are being exposed to this AI.
Dr. Jean-Claude Kate.
Sorry, can I just quickly add something? Sorry, not just the kids, parents, because I have a lot of retired parents on WhatsApp. I also think they need to learn this because I know they see AI things and think it's gospel written. And they follow a lot of advice. They don't realize it's avatars, it's wrong. So that's one thing I've had to do with my mom. So I just want to say, our parents, please watch out as well because they're taking a lot of information.
Chief, the one thing is learning is fun. So if you have the chance, once we have the full series of the DocAI Academy Animation Universe for learning AI, we are going to make this available on our platform. It's going to be free anyways. So you can make sure you go in there and get your family to learn how to use AI.
Dr. Kate.
Yeah, thank you. It's a question. Prof, during your presentation, you showed a case scenario with ultrasound. So was that something inbuilt particularly by your workplace to aid you in your practice, or is it open for other people to use, like echographers or ultrasonographers in Cameroon? Can they use that? And then my second question is to the developers, Louis and Sintieh, for example. Can we build these AIs based from scratch in Cameroon using our background Cameroonian data to support healthcare? One key issue is that I think we've talked about electronic medical records. Sintieh, you mentioned it. That is something that we are still way behind in Cameroon. Can we use AI to leapfrog, as we've said, to come up with electronic health records for our Cameroonian medical system? Cameroon has an AI roadmap till 2040. We don't know where the road will lead us to, but there is a roadmap.
Can you just bear with me before you answer the question? Please just bear with me. I think for time management, I will need to ask a number of questions, and so that it's easy for us to address them. Dr. Ngaka, you wanted to raise a question? Just bear with me. Just mind the question from Dr. Kate, because it's to do with how do we address this in low resource setting.
Yes. Hello, I'm Leonard. I'm asking the question as a trainer because we have responsibilities to help orientate the students we are training about different careers that they can engage in future. I've learned a lot. I've learned recently that opportunities do exist for medical doctors to work with AI agencies to train different AI models. I heard so of recent. My question is, how sustainable is this? Can that be a career path that someone who is in medical school can decide that I want to do a medical informatics or something, and I eventually go down the road to build a career for 40 years just training AI models, or the training of the models will last just for a short time, like 5-10 years or so, and then people can go back to doing their ops and gynes and neurology.
Excellent. Question noted. We'll come in before you answer that. Please just be noting this. We've got right now, Dr. Reitner, and then we've also got Dr. Kojo Denecho. Dr. Reitner first, and then the microphone, Dr. Kojo Denecho. Can we just be noting the question, because for time management, we want to capture all the questions, and then we address them.
Thank you very much for your lovely presentation. My question is to Dr. Phyllis Nafti.
Can you get the microphone?
Okay. So my question is about availability of internet services and connectivity. I know all this conversation we're having is about AI, but without adequate internet service, there will be no AI for anybody or even adequate up-to-date information. At this current point in time, there is like Satlink available in most parts of Cameroon. And with at least, I think, maybe 600,000 francs, and maybe paying like 50,000 francs a month, you could have like a wide area covered where people can get free Wi-Fi. So my question is, has this been explored in like university settings and in our hospitals? And if not, is there any particular reason why that is the case? I know we are exploring options like using other subtle versions of AI with, which can handle lower bandwidth and things like that. I'm just trying to wonder, I think, would it not be a better solution to try and get internet access to all these areas if possible?
So in essence, trying to capture a picture of what obtains at the moment. So we got three key questions. We're going to Dr. Kojo Ndenecho for those who, I suppose those who are not CamDoc member. Dr. Kojo is the Vice President of CamDocUK, sitting next to the President, Dr. Linda Bello. Dr. Kojo, you got the microphone. Quick question.
Yeah, thank you very much, panelists. Very honored to have you, and especially our guest from Dr. Ngek. Here with us. I don't know whether mine is a question. It's just more of an observation and maybe bringing some other views. Regarding the lady is it Clarice? Christie, who died, unfortunately, in Cameroon. We forgot to mention that we need desperately to have databases. It is a very cultural problem. There are certain things we can do, there are certain things that government needs to do, but we also have to develop that culture. You forgot that she toured over 5 hospitals. We have to have databases of what hospitals are open, closed, can take category 1, category 2, category 3 to go there. She did not have to be going from one part of Yaoundé to the other part of Yaoundé. She died on the way. I am here. I am been a member of a group of over 250 doctors, mostly based around the southwest in Cameroon, and there are also diaspora doctors from all 5 continents. One of the things, and you would be very familiar with this, from time to time you hear on the WhatsApp group, oh, do you know a good neurologist in Yaoundé? Look, I'm telling you, I've been a member of that group for, what, 7, 8 years? I follow MedCam France. In those things, you hear doctors from time to time, even in our groups, asking for an orthopedic doctor here. A database of physicians. You know, we go on that. We've not thought about creating one. We have to do that. Just a list of doctors who are in different towns would help. This is us physicians, we are not be able to do those things. We should be thinking. The point is that there are certain aspects of things that we need to be proactive about. There are certain things we need to then push government to do that. You forget. We're talking of, oh, are there policies of AI here and there? I will tell you, you need to have roads to be able to have cars to run on them. You cannot be making highway codes before. You need users. Universities in Yaoundé, let me just give you a little test. Go and Google University of Yaoundé, University of Douala, and find out what is on their website. You would cry. It's a page for most of them.
Yeah.
So you're now talking about, have they got AI policies? Look, these are guys who do not have a web page. CamDoc organized a conference 2 years ago. We wrote emails. There were professors, deans. They don't respond. They don't even make use of their emails. So you can see some of the tasks. Some of them is our fault. Some of them are things we need to do, culture and things like that. CamDoc today is partnering with AI specialists. Why? We know we don't know all. We know we have to. You have to have vision, leaders with the vision. prepare them. And some parents who did not go to school knew that school identified school was important and sent their children at all costs.
Yes.
Those
Okay.
are some of the things. That's me done.
Yes. Excellent. I think it's more, as you said, it was more of a recommendation statement, and I'm sure the co-moderator is actually noting that, because we're going to come out with all this as we produce the outcome of this meeting today. If we've been capturing questions, so the final question we're going to capture is coming from our representative, Cameroon Medical Council, the president of the Cameroon Medical Council UK branch, who is Professor Theo Ngachu.
Yeah, thank you, Chief. I don't have a real question as well, like the Vice Chair said, but there are a few things I wanted to make some of us realize, because there are lots of things that we can actually reproach Cameroon government for, but there are lots of things that we actually need to be aware what Cameroon government is doing. From my take, I think Cameroon government has a very poor attitude of informing the citizens of what is actually going on in the country. Now, Dr. Ndenicho mentioned about having a database of doctors. Okay. The Ministry of Health has just created a platform for diasporans to actually register on the platform. And registering on the platform, you actually identify who you are, what you do, and what you want to do for Cameroon. So that is a database that is available. And people will need to register on that database. And like I said, the government needs to be communicating that information to people, so people should know. Okay. Now, that having such database, and I think they have the database in Cameroon, the problem is they don't actually tell people that it exists, because in Cameroon, every information is being guarded as if it's a treasure, failing to understand that that information needs to be disseminated. And today we are talking about AI, and people have mentioned about electronic health records. Cameroon government also has a plan for electronic health records. And I think they've signed an agreement with a UK company to provide electronic health records to Cameroon. But that is still information that is not being disseminated. So you probably need to go and dig in the literature and in the internet to identify those things. But there are lots of things happening in Cameroon. So please don't be despair.
Okay. I think what is coming across clearly, because we push for time, we've heard about the questions coming across back to low resource setting issues. We heard about, of course, career advisory issues, like what Dr. Leonard was saying, they're questioning whether, there may be questions, but they are prompt also for us to put in our end of program information position statement, which we're going to take forward. But it is important that I should give the panelists a couple of minutes, or 1 or 2 minutes, to actually make it, just comment on the question that you've heard. Who is going to go first?
So I'll start, because I have 2 questions that I think were specifically relevant to me. We talked about the scan software. So a lot of the systems will have software that comes with it. And the one I was using is from GE, it's called Voluson. So it's an integrated automated system from that particular company. But most ultrasound machines, including the Chinese ones and etc., have automation in them. So if you're, the sort of simple basic one that's existed for years was, if you get a section of the head, it will measure it automatically if it's the right section, right? So that's existed for quite a long time. The new thing is the fact that it's in real time capturing what you're seeing and saving it automatically, so the workflow is quicker. So it comes with the machine and at cost at the moment. So it's not inexpensive. The second thing that someone asked was about careers in terms of AI and medics. Absolutely, I think it's an option. The reality is that a lot of medics, we don't realize the skill set that we have and what we can do with that skill set. You know, a lot of us traditionally always thought we had to be ward or hospital-based physicians. The young generation absolutely don't think that way. And that's a good thing because you can use your skill set. Remember, you had the best grades in your school, generally speaking. You were the smartest in your class. There's nothing that you can't do with that application. And if you finish 5 years of medical school, you're resilient, you're adaptable, you're pretty clever. So financial companies, institutions in the city, all would be quite happy to have that skill set. And who better, if we're concerned about AI and sort of the direction of travel, is we need to have representation in that field as physicians. I mean, obviously, you want to have the whole breadth of experience of physicians rather than just the sort of newly qualified to be inputting into that field. So yes, it is a field, and I'm sure there's an opportunity there for people to consider. I would think so, yeah. Question.
Okay, there was a question about developing models of Cameroon. I think we've touched on that earlier. It's possible that could be. Like I said, like I said earlier, the issue is not about developing models. It is if the environment is enabling. You can't wait for the government or the public sector to do that. That could be driven by the private sector. But unfortunately, the question which we're asking is the environment enabling enough in such a way that if you are developing that model, it will easily be adopted. How is the government of Cameroon enabling private individuals to build these models in such a way that they could be incentivized, maybe tax incentives or whatever way they can do it? And then there was also another question about internet connection. We've already touched on that we could develop IoT of things where models can actually work on devices that are not and then whenever they connect to the internet, they could upload the data to the cloud for any form of updates. That is doable. So to sum it up, these things are all achievable. It depends on our willingness to get them done. Thank you.
Yeah, I think I had a question about connectivity, satellite, university and yeah, you've touched on that. And I just want to quickly say that my experience is that they had, I think I don't know if anyone has been to the Faculty of Health in the University of Buea. Yeah, so they had this big, if you go outside, there's a big satellite, whatever. So when they built it, they had all of that. But maintenance, cost, or whatever, they didn't maintain is what I was told. So it's just maintenance, is cost and prioritization, saying this is a priority, we need to do this. So I am a visiting professor, so I only go once a year, so I've not been into it, but it's something I raise all the time because I was saying to the CamDoc planners that when I did my webinars this time teaching, day one, it wasn't just even the internet, it was Sonel went off. So 2 hours into my webinars, I get a message. I realize I'm talking to myself and I'm asking questions. No one is answering. And then I check my WhatsApp. The class delegate says they have this class delegate system that really works. She says, Sonel has caught light. What do we do? So we had to, the good thing, University of Buea is amazing. I think with the low resources they have an IT manager. So he had a laptop as a backup. And we had the students in the class because they couldn't pay this 40,000. So they all gathered around and I was projected. So he quickly put it on the laptop, got them to come around, and then had a mic that went around the class. And I was then, how did I do my slides? So my slides could only be projected to those with the laptop in front of them. But I was quickly taking pictures of the slide and sending on the WhatsApp group. They created a WhatsApp group for all the students. So they're very, very innovative, and it worked. So I'm just saying it's a wicked problem. So there's no one perfect solution. There's different solutions we need to find.
So you see, again, we're back to low resource setting issues. And the one person who is evangelizing about addressing AI in low resource setting, I'll give you the final word. The final word should be one word. Dr. Sintieh.
Possible. It's possible. So I'm a possibilist, and I believe that we can do it in low resource settings. We don't need to build models from scratch. We can build from the foundation models, and with all the systemic adaptations we have to do, it is possible. So I think my keyword is that it's possible.
Fantastic. So possible. It's been stimulating. It could go on and on. You have the rest of the evening at the gala. You can meet the panelists and take it forward. I just want to say thank you to the technical team that has, Glenn is there, who has been doing a fantastic job. Kingsley, who is here with the Muffuh team. We've got our young Sammy Joe. And you all have been a very fantastic audience. And I think it's about the point where I think my mandate for today has ended, so I should be passing over to the president, who is the president of CamDocUK, or the master of the conference, Dr. MBENE Ngah, and the microphone is yours.
Let's do it. Asaah. Okay. All right. Wow. So thrilling. I don't think we've ever stayed this long for a conference. Thank you all so much for your participation, for the enthusiasm. I hope you all enjoyed the food at lunch. I hope you've enjoyed everything about this. This is just part one. There's more to come. What we would like to do, it's imperative that we have a group photo. So I'd like to call all of you up here so that we can have our group photo. After that, we're going to have some small interviews with Mimi Mefo. A few of us will be spoken to. And then members, Ashia, we need to do our AGM. It's going to be the fastest AGM we've ever done. And then we have to practice. So there's lots of stuff we have to do. For our guests start arriving at 6, hence why I was kind of trying to say, wrap it up. Normally, I would have said, let's continue. But as I said from the beginning, and I'm going to end with this, I want to, first of all, I know we've already spoken to him, but where is Sammy? Hello. I want you guys to give this, our young man, such a big round of applause. He's the nicest, kindest, like literally, Kojo, you should be so proud. I don't know what we would do without you, Sammy. I really don't. And he's been there, sat there, and we didn't even know if we were going to live stream. He suddenly made it possible. Everything that we think we wanted to do, he makes it possible. We've got a new website, which is totally revamped. He's done it for us. So this young man, he's so amazing. So thank you so much, Sammy. And Chief, you remember when we were looking for a topic for this conference, right? And we were like, what are we going to talk about? What are we going to talk about? And you said AI. And Chief, look what's happened. You must be thrilled. And thank you so much for telling me we need to do this, we need to do this. You moderated it very well. Sorry, I kept telling you to round it up, but you know why. But thank you so much, Chief. We love you. You're our usual suspect. You'll stay with CamDoc until, yes, you're part of the fixtures. Gael, thank you so much. Merci beaucoup. And a special thank you to Dr. Clarice Kinge for coming all the way. She came here last night. She's come with her husband. She's come with her daughter. And last year she couldn't come, but she still supported us. So I really want to say thank you so much. Merci beaucoup. Louis, thank you so much for everything you do for CamDocUK. Thank you for the free Doc AI courses. Now you people see what Louis has given us. We still have many spaces for this Doc AI course. It's really good. Please ask Anna or I. We will register you in the course. You can see that it's something that we need. It's like literally you don't want to be left behind. The Naftis, all the way from Qatar. I remember when we were trying to sort of build who was going to speak. Fee is a fellow lesson like, oh, Sintieh's gone. Fee is a fellow lesson like Anna and I. I'm not saying lessons are wonderful, but there you go. When I need something, like Fee has done many webinars for us and other things. Oh, he's back, perfect. And I asked, I said, what were we talking about? I don't even know what we were talking about. We're talking about something else. And she said, oh, I've done this thing about AI. You were at an AI conference and you sent me your things. And I said, hey, we're doing a conference. Do you want to speak? And she said, yes. And they said, do you know who else is good at speaking about AI? It's us. I said, thank God, God they help. And that's how I had 2 speakers. And then we have this our gentleman here. This our Sintieh. This our CamDoc member in Switzerland that I've told him that if he joins Switzerland, he should not even dare, that he remains a CamDocUK member for life. Sintieh, thank you so much. We enjoy, in fact, today I'm so overwhelmed. I forgot, okay, Stefan has gone. Thank you so much, Sintieh. I know you have to do MC for your uncle's 60th, that's why you're not here. But thank you, I know you have to go and do things, but you've stayed on and you've really, your participations and everything you've done has been really good. Et ton français là, très bien, très, très bien. Stefan has gone, Dr. Bola, but we will send him his own congratulations, but I'm sure you can all agree that he was amazing. Our Collins, our young generation here, Collins, he's amazing. Let's just say Collins is amazing. I had to find a way, yes, let's say nepotism, I had to find a way of getting him on here. And as you can all see, he did a great job. So I'm really pleased. I'm very overwhelmed. I'm so happy. I'm so glad that Mimi Mefo are here and they have captured this. Our conference is like, Anna, we didn't think that we were worried. We didn't think that it was going to be the way it was, but it's really been more than what we expected. And so I'll end my little speech here by saying, this is my other half. We're not married, but this is my other half. And yes, we have spent some sleepless nights, but I really want to say thank you to this lady because a lot of what I do and how I can run the organization is really because she's the yin to my yang. So there it is. So well done, Anna. We've done it. On to part 2. Hopefully we don't collapse, but I'll leave the final word to you. There you go.
I'll be very brief. Thank you, everybody. Thank you for taking time to attend this conference. And once more, thank you to all the wonderful speakers. Very informative conference. I think we forgot somebody very important. Flora, stand up. She's been part of the organization with Collins. That's one of our very young members. Future GP, she's a GP training. Yeah, they've helped us a lot. They joined us in the sleepless nights. Thank you so much again. And yeah, as Linda has said, the next phase is the AGM. I will have to run after the interview because we've got the hall to arrange. So picture and choreography. Thank you everybody again. Bye.